What was the first time we had medical in Port Arthur? 80, early 80s?
Okay, 81, 82.
Because I know we didn't have it when I first started, and I remember the defibrillator
We started providing advanced life support.
and the defibrillator, I was accused of electrocuting people. Anything else, Chief?
That's it.
Okay, Ken?
Can I make a suggestion? What I would like to maybe suggest to the council is that the mayor begin to talk at VCOG about this particular issue, because it's a policy issue. And what the issue is that this council here may in fact see it this way. But what we're finding is countywide, it is not. Okay, the other councils are not having this type of policy discussion. If the vice mayor could have the same type of discussion at Volusia League, even though it is similar people, in some cases there are different representatives sitting at the Volusia League.
Well, the Volusia League has more
Correct.
members there.
That's correct.
There's just one representative.
Okay, but I think it's also time that we invite our Southeast Volusia people to come together in a regional summit and have a discussion, really policymakers to policymakers, because in fact the Southeast area would be the easiest of all the areas to really move to implementation.
Mm-hmm.
Because, essentially, we've been working on this thing for a number of years.
Mm-hmm. We have some very non-intrusive ways that we might be able to make this work.
And we have a governance structure that works. And basically the governance structure that we're using for the RCC model is one similar that is used down in St. Lucie County, and it's often referred to as the St. Lucie governance model. And where the participating governmental units actually appoint a member to that governing body that governs the district, the fire district. And it has worked very well down there for more than 60 years, because it was created in the 50s, as I recall, late 40s and the 50s down in that area. So I think it's one that has a great promise within the Southeast. And Tom, at the fire chiefs, if he could say, okay, my city has said, hey, come talk to fire chiefs. And if you would say to manager, go talk to managers. Just kind of a plan of action, but I think the regional summit type of thing, where the councils could come together and have a discussion about the regionalization.
We have to begin the discussion process or nothing ever happens.
That's right.
You gotta make some movement. Because I can't believe that any other city is not going through the same thing we are. They're not anymore. They got the same problem we got financially. So, all right, thanks, Tom. Anyone else like to speak to this? Back to the council. I think, Ken, we have got, each of us must start speaking to other jurisdictions to find out what their input. I don't think you're ever going to bring Daytona into the loop. You can just wipe them out. You can waste everything. You need to, like Ken said, I think you need to work with the ones we can work with and see to make it work. Again, everybody wants a service. They don't want to pay the tab. You got to find a way to reduce it. Anything else, council?
Okay. Also, if the council doesn't object, we'll be working with the Civic League on providing data and things of that sort. And I think that's worthwhile, and I just think that it's probably something good for us to do.
What invitation did I get to go to some civic thing that said?
That's their annual meeting.
And it said, at first it said business, and then I noticed it said black tie only, which absolutely eliminates me.
That's what I noted, that the mayor will not be attending this function.
I was there quick. So anything else, Dennis?
No, I would like to make sure that we take some time to discuss the opportunity for EVAC and how we can maybe bring that more into line with the needs. We've got to get something moving to try and reduce this somehow.
Bob.
Well,
personally, my opinion is I think we're going to be spinning wheels getting other people involved. With the exception of EVAC, I just don't see other people, caring about it. I mean, you talk about an issue that's 25 years old, trying the consolidation method, I just don't see it happening. Everybody's going to do their own thing. I do think, of course, we have a system right now for medical response that obviously is very essential to our citizens because there's no other method that's incorporated right now. And I think where I'd be coming from is certainly would want to see the continuation of our medical response because that's the system that's established right now. But I think in the long run, if we look long term, I think we're going to have our own separate entity here. But I think maybe a cost-saving method is that we have, again, medical personnel responding to medical issues, fire responding to fire issues. So where we can have those two issues join for a reduced cost somewhere down the line, I think is the issue for me. Obviously, what our fire department provides our citizens right now is essential. We have to have our firemen as first response for medical issues. Long term, I have no problem with what our fire department does. They provide a great service for our citizens. There's certainly nothing that can be done immediately to curtail the service that is absolutely necessary for our citizens. But I think, again, the long term is medical versus fire, I think, is the key.
Okay. Mary, closing comments?
No, I think Ken's recommendations and the recommendations of talking with having a joint summit with the other groups and getting them to help us work on the issues would be a great idea. I think we're all going to have to work on it.
George?
Yeah, I'm willing to look at it, but you got to have it's like insurance, If you either have it and you have good quality insurance, or you don't have any, do what you want to do. But one of the reasons I moved to Port Orange is because it had a paid fire department and it also had a good police department, And public safety, I think, is paramount in most people's minds, and that's why they live in Port Orange, is for the public safety. People for years built around forts because that's where they wanted to be. They felt safe. And once the people don't feel safe here anymore, that most of them are going to be gone.
I think it says Port Orange, not Fort Orange.
Port Orange.
Having said that, the next issue is approval of the 2009